Good afternoon, everyone. My name is Nancy Weaver, and this is my PowerPoint on unifying vision, strategies that influence nurse care self-practices. This PowerPoint represents my quality improvement project for the Doctor of Nursing Practice program here at Jacksonville State University. I would like to thank all of you in advance for allowing me the opportunity to participate in the dissemination of this project today. Self-care is a lifelong habit that individuals engage in to take care of themselves. It is a broad concept encompassing hygiene, nutrition, lifestyle, environmental, and socioeconomic factors. Research studies demonstrate there is a significant value to an organization and to individuals when it comes to educating nurses about self-care. In a 2019 survey, researchers concluded that nurse burnout contributed to the lack of quality patient care, and 56% of nurses surveyed stated that they felt their organizations were ineffective at addressing these issues. Other research studies found that nurses who self-report high levels of stress also experience increased levels of pain and depression. Further, correlations were made showing that these nurses were less likely to be engaged with work activity, thereby leading to increased incidence of patient falls, medication errors, and decreased quality metrics in general. Sometimes it's difficult to find the time and energy to take care of oneself. However, nurses who practice self-care report less stress. High levels of stress can lead to exhaustion, fatigue, tension, and of course, burnout. The World Health Organization reports that during COVID-19, nurses exposed to high stress conditions that threaten their health and well-being severely affects their ability to work. Nurses' reactions to the stress of the current pandemic must be viewed from an occupational health and safety perspective. According to the WHO, the shortage of nurses will interfere with the national and international efforts to optimize the health and well-being of our global population. Now in 2021, the COVID-19 pandemic, the WHO declared burnout an occupational phenomena rather than a medical condition, characterized by feelings of exhaustion, disengagement from one's job, and a sense of diminished professional fulfillment. Burnout is considered the result of chronic work stress that the individual is not able to manage. The onset of the COVID-19 pandemic has increased work stress among already strained nursing populations, putting their mental health and their well-being at risk. Most self-care techniques can be learned and implemented in a short time without the need of a gym, equipment, or considerable effort. The implementation site for this project was a physician-owned multi-specialty clinic that offers a wide range of services. This site was appropriate because of the large number of nurses working in high-stressed areas in the clinic. The clinic has more than 250 healthcare professionals that provide integrated care across more than 40 medical specialties and services. Executive leadership expressed concern about stress and burnout among their healthcare professionals. The leadership team recognized that self-care practices among their nurses could directly affect patient safety, satisfaction scores, and well-being for staff. In a 2020 report, researchers related high levels of stress, depression, anxiety could lead to post-traumatic stress disorder in healthcare workers. These findings offer evidence-based support for the Quality Improvement Project. The facilitator used convenient sampling to recruit professional nurses currently employed at the project site. This population included nurses from various demographics, backgrounds, and experience levels, education levels, and lifestyles that were various degrees of education and work history, with the majority of nurses having an associate degree and an average of 3 to 5 years of experience. A project-focused question was created using evidence-based framework to keep the project on target. The PICO question: in currently employed nurses, will the use of a website on self-care strategies for nurses versus not using the website increase awareness of self-care practices among nursing staff in a multi-specialty clinic? The objectives for this project were to first develop a website containing creative strategies that support a healthy lifestyle and encourage nurses to engage in self-care practices. Secondly, educate the nurses on how to access and use the website. And thirdly, evaluate the use of the Unifying Vision website. The literature review sought to evaluate current research on the relationship between nurses' self-care practices, healthy work environment, and the effects on patient outcomes. Studies support the notion that a lack of nurses' self-care can significantly impact their engagement and an organization's retention of competent staff. In a recent CDC report, the CDC informed the public that the current COVID-19 public health crisis has made it more critical than ever for one to take time for one's self-care, stress prevention, and engage in healthy coping strategy. Coe and Kaiser Larson, 2016, reported that nurses must have the necessary tools to engage in stress management. Crane and Ward, 2016, research showed that an organization's human resources is its most valuable asset, and the importance of supporting a healthy work environment must be considered. In a 2018 study, researchers concluded that the nurse's physical, emotional, and social dimensions of self-care practices can reduce the adverse effects of a less than optimal situation. These findings signify that it is essential to investigate the constructs of self-care to mitigate the emotional demands in a highly stressful environment. Stige and Rainbow 2016 study clarified how nurse fatigue and nurse professional attributes affects nurse retention and job satisfaction. Dorothea Orman theory, known as self-care model, was used as the theoretical framework for this project. Orm's theory focused on the individual's capability to perform self-care, which is described as the practice of activities that individuals initiate and act on their behalf to maintain good health and overall well-being. The Plan, Do, Study, Act model for quality improvement was used for this project. The PDSA model is a systematic process created by Dr. W. Edward Deming that applied a staged approach to improve the quality of processes and ensure the best outcomes. An educational offering that aimed to influence nurse self-care strategies was developed, and 15 nurses participated in the project, where they were introduced to the Unifying Vision strategies that influence nurse self-care practices website. The instrument used in the project was a wellness assessment scale and the Unifying Vision pre- and post-implementation questionnaire. The website presentation, combined with a corresponding detailed explanation regarding the website, introduced participants to the strategies that influence the practices of self-care. 15 nurses took the practice test and post-test. Of the pre-test group, 66.7% reported they currently did not use websites dedicated to self-care. After the educational offering, 100% of the post-test group reported that they felt like the Unifying Vision website offered tools needed to practice self-care, and they had more confidence in their ability to engage in self-care activities. The project participants also completed a second 30-day post-interventional questionnaire. Of the 15 original participants, 73.3% reported that they had visited the Unifying Vision website 11 or more times in the last 30 days. This QI project identified that the intervention positively impacted how participants viewed self-care and an increased willingness to utilize websites to promote self-care. After participating in the session to learn how to navigate the website, this group of nurses were much more likely to frequent the website and found Unifying Vision website helpful in providing tools for self-care. The project validates current research that supports self-care practices for nurses as needed. A needs assessment resulted in an internal evaluation identifying nursing turnover rate as a clear indicator of a pending crisis. From a nursing perspective, the labor market continued to tighten, with 59% of hospitals projecting to increase their nursing staff. In terms of barriers, the clinic experienced a staffing shortage because of the raging pandemic. Healthcare personnel shortages continued as the COVID-19 pandemic progressed. Direct and indirect exposures to COVID-19 or the need to care for family members contributed to an already challenging predicament. The clinic followed the most recent CDC guidelines to mitigate the COVID disruptions of daily operations and project implementation. This DNP project concluded that a website containing creative strategies that support a healthy lifestyle and encourage nurses to engage in self-care practices is a valuable tool. Participants responded in the post-interventional questionnaire indicated that the website is one that they would continue to use now and in the future. The project demonstrated the development of the Unifying Vision website and providing an educational offering that aimed to influence self-care practices helped increase awareness of creative strategies that support a healthy lifestyle and encourages nurses to engage in self-care practices. The sustainability of this project will be achieved by a quarterly review of evidence-based articles regarding nursing self-care strategies. The Unifying Vision website will be updated quarterly if new self-care strategies for nurses are identified, and the project facilitator will notify the project participants and new staff nurses via email each time the website is updated. Thank you so much for letting me participate.